Okay, I think perhaps we will get started. We might be expecting a few more people to join, but they can just join in. So welcome to this information session on the Creative Health Leads in Systems programme. So if you'd like to introduce yourself in the chat, please do so. My name is Jane Howard. I'm the programme manager here at the National Centre for Creative Health, and I'm joined by colleagues here today supporting me in this session. Now we're in webinar mode, which means that you'll be muted and your cameras are off. Although when we get to questions, we can unmute you when we get to that point. We are recording the session, so be aware that although you can't be seeing your initials, will be seen in those little boxes down the side. But we will be in presentation mode for most of the session, so it'll be the slides that you'll be seeing. I think that's it. I think Alexis, my colleague, has put a few things in the chat around if you've got any problems with technical issues or anything like that, do let us know. So welcome to the session. I'm going to run through a presentation, and there is quite a lot of information to share with you. So I will be fed up with the sound of my own voice by the end of it. So I'm hoping that you will have questions so that we can hear some different voices as well. But I'm going to run through a presentation which will give you an overview of the programme and what we're looking for, details of the application process, and then there should be plenty of time for questions at the end. Please put your questions in the Q&A. Rather than the chat. It's easier to keep track of them, and you can do that as we go along. If we don't have time to answer all the questions that are posed today, then we will follow them up, and we will be posting all responses to questions on our programme's webpage so that others can see them. We won't be identifying who asked the questions, so don't let that inhibit you in any way. Okay, we'll get going. So just very briefly, in case we have people on here who aren't familiar with the National Centre for Creative Health, the NCCH, I'm just going to begin with a little bit of background. The NCCH was formally launched in March 2021 with a mission to advance good practice and research, to inform policy and promote collaboration, and helping to foster the conditions for creative health to be integral to health and social care and wider systems. So clearly this programme is a really important aspect of that mission of making creative health integral to health and care systems. We define creative health as creative approaches and activities which have benefits for our health and well-being. Activities can include visual and performing arts, crafts, film, literature, but it also includes things like cooking, creative activities in nature, such as gardening. So a very broad spectrum of activity. And creative health approaches involve sort of creative and innovative ways to approach health and care services. It's about things such as co-production, creative approaches to service redesign, lived experience. So we can also think about creative health approaches as well as creative health activities that have benefits for health and well-being. And creative health can be applied in all sorts of settings, so in homes, in communities, as well as in healthcare settings and cultural and heritage sites. And creative health contributes to the prevention of ill health, the promotion of healthy behaviours, the management of long-term complex conditions, and treatment and recovery right across the life course. So it is a very broad definition and a very broad spectrum of work that we're engaged in. So what's this programme all about? Well, the purpose of the programme is to enable strategic and operational integration of creative health. So it's to integrate and embed creative health into sort of key NHS and broader health priorities. So it's about public and population health. It's about looking at the opportunities for creative health in clinical and care pathways. And as the development of the neighbourhood health service gets underway, it's looking at how creative health integrates into that new service model. And we see creative health playing a key role in the three shifts in the 10-year plan for the NHS in England. That's the treatment to prevention, hospital to community, and analogue to digital, as well as making a contribution to system change and transformation overall. So as a result of this programme, we want to see an increase in creative health activity in health and care systems, which we then believe will contribute to a more person and community-centred system and reduce pressure on the services. So just some key points of the programme. It is supported by Arts Council England and the Bearing Foundation, and the initial funding for this first round is provided by Arts Council England. It builds on the learning from our Creative Health Associates programme, which ran from July 2023 to March this year, in which we had 7 Creative Health Associates, 1 in each NHS England region, and they were each hosted by an ICB, an Integrated Care Board in that region. And that programme really identified where the best opportunities exist to embed and integrate creative health. It catalysed new networks and partnerships between the health and care and creative and cultural sectors, and really demonstrated the potential of such roles to contribute to wider system transformation. So we're using the learning from that programme to inform the development of this programme. We anticipate that this programme will run over the next 3.5 years, and that there'll be a rolling programme of opportunities for systems to apply to be part of it. So we're launching it now, but we're expecting to have further rounds to follow. And it is a health and care system facing programme. So it's a focus on supporting the 10-year plan for the NHS in England, including addressing health inequalities, which really underpins a lot of the work that we do here at the National Centre. The programme offers a salary subsidy for a creative health lead role, and I'll give some more detail on that in a moment, but it's basically it's roughly a 50% salary subsidy in year 1 and 30% in year 2. We're anticipating 25 to 30 posts over the next 3 years. We've got 5 available now. We think the final round of posts will be agreed probably March to June 2027. So we're funding 5 posts in this first round, and we'll announce further numbers as the funding becomes available on that rolling programme basis. The programme includes a structured development programme for the creative health leads and for others working in the system. And again, I'll say more about that shortly. And a key difference from this programme to that of the Associates programme that we ran is that these roles will be employed within health and care systems. Again, I'll say more about that in a bit, as there are various options for how that employment might work. So let's take a look first at the money. The programme will provide, as I said, a salary subsidy of approximately 50% for the first year and 30% for the second year. And this is based on the roles being 4 days a week, 0.8 whole-time equivalents. What we're finding is people are increasingly wanting to get that better life-work balance. So we think 4 days a week is a good offer. And the salary is costed at the entry point level of an NHS Band 7, or the equivalent in another organisation. So I can give you the detailed figures for those if you need them, but we've worked out with on costs that is around, we're providing that support of around 50% in the first year and 50% in the first year and 30% for the second year. And we factored in 3% cost of living increases in each year. So in the first year of a role, we will provide £25,000, and in the second year, £15,000. So there's total support of £40,000 over 2 years. And therefore, the match funding requirement is £25,000 in the first year and £35,000 in the second year. So a total of £60,000 over 2 years. We're not wedded to particular financial years. Our financial year is different from that of the NHS anyway. So it will be for organisations to work out how best to manage this within their financial years. But it can, the commitment is for 2 years, but it can run over more than 2 financial years. But there is a requirement to commit to a 2-year post. The other really important issue here is that match funding cannot be from arts funding or culture budgets. This funding that is being provided is aimed at leveraging in funding from the health and care sector. For a long time, this work has been funded pretty much exclusively by arts and culture budgets, and we're trying to shift that. So the match funding cannot come from arts and culture budgets, but it can come from a number of different sources. So we've already had conversations with places where match funding is being provided by 4, 5 or 6 organisations, local authority, public health, NHS Trust, ICB, etc. And that's what we're anticipating, that that match funding will be made up of funding from a number of different partners. Clearly, that means that there's less to find from each individual organisation, which makes it a lot more doable. But obviously, if one organisation is able to fund the whole match, that's absolutely fine too. I'll just say a little bit now about the development programme for the Creative Health Lead post holders. So the purpose of this is, as it says, to provide a space for creative health leads to exchange knowledge, discuss challenges and opportunities, and build their leadership skills. So whilst we expect the creative health leads to be integrated into their local teams in whichever organisations and partnerships they're working in, we also know that their roles are probably quite different to many others in those organisations. And they'll be working in contexts where they could sometimes feel that's quite challenging. They could feel quite alone in terms of what they're trying to achieve. So we think it's really important that there is a programme that brings them together as well, so that they can share their learning and progress. Now, the programme will be co-designed with the creative health leads, but we have drafted out a sort of programme as a starting point. So the programme will be designed with sufficient flexibility so that it can respond to the programme as it evolves. And over time, as we get more of these roles, we may develop regional learning networks or thematic groupings as we get a very large group of creative health leads in place. We're expecting that the creative health leads will come with a wide range of different experiences, skills and knowledge. So we anticipate that peer-to-peer learning will be a really important element of the programme. We're suggesting that there's a sort of intensive learning sessions over an initial 4-week period, which will include things such as making sure we all understand the purpose of the programme, understanding the health and social care landscape and the creative health landscape, a sort of bringing us up to speed on the latest evidence and research, information about health inequalities and population health. And so that intensive learning sessions would be repeated over the lifetime of the programme as new roles are established. So we might expect to have, at least 3 of those blocks during the first year of the programme. And then we're looking at having 6 weekly online peer support and learning sessions, which would cover a whole range of topics. Again, this will be for us to co-design with the creative health leads, but we're expecting to be looking at things such as commissioning and funding models, looking at impact measurement, updates on evidence and research, working with lived experience, using health and other data sources. So a whole range of things in those sessions. And as I said, the peer-to-peer learning will be important. So skills and knowledge exchange as well amongst those team members. And then in between those 6 weekly sessions, we would have some optional online drop-in support and development sessions, which I would be facilitating and using principles of action learning and human learning systems to support individuals with particular challenges or priorities that they have. And we anticipate for this programme that we would be working closely with partners such as the Culture, Health and Wellbeing Alliance, the National Arts and Hospitals Network, Metro Mayor's Creative Health Network, GLA, London Arts Health, others, plenty of people in this whole field, because we want to really ensure that this community of practice that we're developing is really inclusive and that everyone working in the sector can benefit from the collective knowledge and perspectives and experience of the sector. So we will be coordinating closely with colleagues in those organisations. I also mentioned that we'd be expecting to work with the wider systems on a development programme to help embed creative health in the system. And again, we anticipate that this will involve, workshops on particular topics, maybe testing out some tools and approaches, sharing learning about models of effective working. Again, we'd want this to respond to the needs of the systems, but we're putting an initial programme together. So there will be an expectation and I think be hopefully welcomed by systems that they can engage with peers in other systems to share their learning and experiences. So thinking about the roles then, we expect these roles to be bespoke to each system. So they will need to respond to the local context and priorities. We have drafted a core job description, which is in the information pack that you can download from the website. But that can be adapted for those local contexts and reflecting local priorities. And we're also not being prescriptive about where posts are based. So when we first began discussing this programme, sort of a year or more ago, maybe, we were talking about these roles then being in integrated care boards. But since then, we've had this sort of restructuring of the NHS and including the development of the neighbourhood model. And, the future role of ICBs is still to be clearly defined. So we've gone for a much more flexible approach. So the creative health lead role could be in an ICB, but it could be in an NHS provider organisation. And we're hearing about advanced foundation trusts and integrated health organisations where providers will take on additional responsibilities for the healthcare of the wider population. So they might be appropriate places for these roles to sit. The development of the neighbourhood NHS provides also further opportunities for roles to be sitting in those spaces, and they could also sit in a local authority public health team. And then there are other organisations across, we're anticipating the wider VCFSE sector, who have formal partnerships and contracts with the NHS and where it might be appropriate. So, for example, we do know of places where they have system-wide lead roles, for example, for end-of-life care, that are funded with health money but are employed by a voluntary sector organisation, and they work across and on behalf of the whole system in that role. So we're not being prescriptive, but we don't expect these roles to sit within creative or cultural organisations or teams. This is about embedding this in the health and care system. And in terms of recruitment to the role, again, that will be for the employing organisation or partnership to determine. We're not going to specify that recruitment process, as long as obviously it's legal and there's a process that can be justified, but we won't be specifying what that recruitment process needs to be. We've just listed here some examples of how roles might work. There's a little bit more information on these in the information pack, and this was out of a series of sort of consultations that we did with people in systems discussing this programme and what it might look like. So these are some examples, but they are only examples. There are other options. So scenario one, this could be a joint post across an NHS and a local authority or local authorities, where the creative health lead sits within an ICB or a public health team, but is jointly appointed by them and works across the whole system. And it may be that that's got a particular focus area. It might be a focus on, for example, mental health or frailty and complex needs or children's health. It could be that that's a particular focus. The second scenario we've got there is about neighbourhood level integration, where the creative health lead works within an integrated neighbourhood team, potentially spanning 2, 3 or more INTs, and they could be employed by the local authority, NHS organisation or a VCFSE partner. And the focus here would be on embedding creative health into that neighbourhood delivery model. Really looking to support the sort of spread and adoption of creative health across INTs. And we're particularly interested in these first phase implementation sites for neighbourhood health, because that will enable us to facilitate sort of national learning with NHS England. So If you're not in one of those first phase sites, don't think that you can't apply, because you can, but we are particularly interested in those sites because of the opportunities that provides to really showcase this work at a national level. But we would, sorry, and the third scenario is where the creative health lead is based within the ICB with a focus on integrating creative health into particular programs of work. We anticipate to be a strong emphasis on health inequalities, and the role might have some broader system responsibilities, but with a focus of creative health at its core. It has been suggested that this role, if that were the case, could be filled by a redeployment as part of an ICB restructure. It would have to be the right person, clearly, but that is something that some ICBs have thought about. And scenario 4 is the NHS provider or provider collaborative, where the role might sit within an NHS provider organisation or provider collaborative with a collaborating provider acting as the employer. So this would be most likely in community providers, where the expectation is that those providers are assuming more of the current ICB responsibilities over time, especially in partnership development and reducing health inequalities. We'd expect to see close working relationships with social care services, especially where those key areas of focus include children and young people, vulnerable adults, addressing frailty, supporting people with complex needs, where that health and social care partnership is so crucial to meeting their needs. So we're anticipating this being a competitive process, although we'll have a number of roles over the next 3 years. There will be an element of competition at each round, I would anticipate. And so here are the criteria by which we're going to be assessing applications. So the more of these that you can match, the higher the application will score. So match funding from NHS or public health budgets would be really welcome. Secondly, the employment of the post holder being within the NHS or public health. As I've said, we've mentioned it could be in other places, but this would score higher if it was with NHS or public health. If they're not employed in the NHS, we would like to see some NHS management support or hosting or some sort of arrangement with an NHS organisation within the partnership, so that the post holder can be part of that NHS family. If a partnership or an organisation can bring a delivery budget for creative health activities, so we are providing a salary subsidy, we're not providing a delivery budget. If that's possible, that would be good to see. If people can commit to a post beyond 2 years, that would also be very positive. We recognise how difficult that is in the current context, but if that were possible, that would be good. We're also wanting to see these roles in areas where there's a real focus on health inequalities or areas of deprivation, because it's where we know that creative health can really have an impact. Integration with social care is important in these roles, and also we're looking for some infrastructure to support the role. So rather than just sort of floating freely around, do they have some group that they can report to, some sort of creative health partnership group or board, or is there a subcommittee or something like that, so that there is some infrastructure around this role, rather than somebody sort of free floating and not necessarily having that infrastructure to support their work. I think it's important to say that we want to support roles both in areas where work is not very well developed, as well as in those where there is existing work, but there's still scope for more. So it's not going to be all about those that are already really well advanced with their creative health work, and nor is it about those where nothing's happening. We're looking for a spectrum over those roles over a period of time. So this programme provides an opportunity to support perhaps new ways of working in systems that have perhaps struggled to get some of this off the ground in the past. We've got some specific requirements. So match funding for the post for 2 years, as I've outlined. Again, I'll just reiterate, cannot come from arts and culture budgets. The posts need to be on an employment contract, not a freelance contract, but it could be a secondment. Again, we recognise the challenges that there are in the system at the moment. So a secondment is a potential opportunity, but it would need to be an employment contract. We would be looking for, if they're not employed by the NHS, for them to have an NHS honorary contract and an email address. We know how important that can be in terms of getting access to people that you need to access within a system when you're working across sector like this. We are expecting applications to come from more than one. I mean, it might be one organisation that puts in the application, but we're looking for it to be across a sort of partnership. So it wouldn't be just the employing body or the funding body that needs to sign it off. We would want to see that there was sign off from other partners. We're not saying that all partners in a system have to sign this off, because I think that would be very difficult to achieve, but it's sort of broader than just one organisation, one internal sort of organisation, because it is around working across the system. And there's a requirement clearly to support the post holders' participation in the learning programme and a commitment to engage in the development programme for systems as well. So the programme is for health and care systems, and as such, we'd expect to see a health and care organisation as the lead applicant. It could be that the lead applicant is not NHS or local authority. It could be a VCFSE health and care partner, for example, but there must be a public sector health and care partner as part of the application. And remember, again, the NHS or public health employment and funding will score higher when we come to assessment. It's not open to individuals to apply, and nor is it open to creative and cultural organisations, although they can, of course, be partners in the application if that's appropriate. Nearly there. So what do you need to do if you're interested? Well, talk to us at NCCH, ask us any questions. There may be things that we haven't, there will be things that we haven't thought of. So please do talk to us. Very happy for you to contact us following this, and we can have some follow-up meetings. There's an application form to complete, which you can download from the website. We've tried to keep it really simple with just text boxes for you to explain how you would use this role. If there are any questions in the application form that you need clarification on, do get back to us. We have a deadline of the 30th of January for the first round of applications, and we'll be interviewing shortlisted applicants online on the 17th of February. With decisions communicated by the end of that month. There's then a second deadline of the 6th of March, and we anticipate being able to communicate decisions on that by the end of March, and we'll confirm a detailed timetable on that as soon as we're able. And as I indicated earlier, we expect to announce further application rounds during 26 and 2027. So we're also keen to hear from systems who think that they will be applying at some point, but not yet. So there is an expression of interest form which can be submitted at any time and which can form the basis of discussions with us. But of course, you can just contact us to discuss the programme at any time. So if you do want to get in touch, contact me via email. That's it from me. That's a lot to get through. I'm very happy to now take questions, and if we can't answer those today, either because we need to consult elsewhere or we need time to think about your question because we won't have thought of everything, we will get back to you, and as I've said, we'll be putting responses on our webpage. So I'm going to stop sharing now. Hopefully I haven't been speaking into the ether. It's always very difficult in these webinar modes to know if people can actually hear you and see you, but hopefully we're there. So I'm going to have a look in the Q&A, see if we've got any questions in there. Okay. Question from chat. So we've got a question. If you found an NHS partner who was willing to host you, linking you into their teams, could you offer the contribution towards the 50% match funding on a voluntary basis? Who asked that question? Sorry, I'm not entirely clear what that means. Who asked that question? Was that
Tina Blabber asked that question. Tina answered that question.
Could we unmute Tina and she could perhaps give us a little bit more? Yeah, explain a little bit more. Got a lot of people on the call. It's difficult to
Hello
find
Tina?
them.
again. Can you hear me
Hi.
now?
Yeah. Hi.
Hi. Yes, I probably haven't posed that very well in the chat.
No, that's
but
okay. That's okay.
I'm based in a charity called Playing for Cake. I'm also sort of a self-employed practitioner, singing for health practitioner, etc. But my query was, if you couldn't find an NHS, a partner organisation to actually host you and pay the 50% match funding, as I understand it, could you, if they were willing to host you and you found a team that were willing to host you, could you then contribute towards those 50%, that 50% match funding yourself, in a sense, and offer yourself on a voluntary basis? Do you see what I mean?
I do see what you mean. Yeah. So you're saying basically you would be offering to work for
My time, yes. If you
less.
could offer time.
No, because we are really looking. I mean, I'm pretty. Yeah. I don't know. I don't think so. We want these roles. I think we want to see these roles working at the level that we've suggested, and we want to see commitment to it by that investment in
Okay,
those
so you would,
roles.
yeah, you would have to find that
Yeah,
a partner organisation yourself. You
yeah,
would have to sort that out. Okay, thank you.
yeah.
Thank you.
Okay. What other questions have we got? Are you looking
Jane,
for
do
new
you want
people?
to go down right to the bottom?
Oh, okay.
Because there's quite a few.
Are there?
I
Oh, yeah.
can tell you the one from Lindsay, if there's two questions she asked straight off the bat.
Okay.
Can funds be used to uplift posts to 8A? And can an organisation apply more than once for funding if it's a rolling programme? Can they apply
Okay.
for funding for more than one post?
Okay. Okay. So if you have additional funds and the post is you want to appoint at a higher level, yes, we'd be supportive of that. But it's not about just uplifting an existing post. I would say. But if you wanted, if we're saying that that's the minimum salary level is what we're talking about here. So you could certainly find the funding, if you could find funding to uplift a post. But if you've got an existing post, it's not really to subsidise, that existing post. And can you apply more than once? We're going to have to take a view on this as we see how it rolls out. At the moment, what we're wanting to see is, a geographical spread of posts across. And so it would be fairer to say, no, we would anticipate that, a system, an organisation will probably only have one post. But if we found after, a year, 18 months that there wasn't an appetite in certain areas, but there was in others, that's something we could review. I think it's also worth saying, I should have said this when I was talking about it in the programme, as it is a rolling programme, when we receive applications, if we're not able to fund the the ones that are unsuccessful in that round, if there were applications that we thought were particularly weak, we would give you feedback on that, on why we wouldn't fund it. But if it was actually an application that, if we had enough posts at that moment, we could fund it, we would probably get in touch and say, do you want to hold that application over and we'll consider it in the next round? And people could add information to it as their context changed. But we're not looking for people to create extra work for people by complete, having to reapply every time if things haven't changed.
Great, thanks, Jane. I've got the next two are from Jane Knight. If people have extra questions when I'm reading out their name, feel free to raise your hand as well, so you can be unmuted. So Jane has asked, could the role sit in a local authority Marmot place? And also she asked, could there be peer-to-peer learning for the post line managers?
So definitely it could sit in a local authority marketplace. We'd need, say that partnership across health and care is what's important. But yes, it definitely could sit in a local authority. For the line managers, yes, I think that's part of the systems sort of development programme. If there was an appetite for that, or there were people who wanted that, we could definitely support that. We did that with the Creative Health Associates programme, where their sponsors who were in ICBs, they did meet up to share their experiences and their learning as well. So that would definitely be something we'd want to try and support.
Great, thanks, Jane. Going on, we had a question from the chat. What geographical footprint do you anticipate local authority area or larger, and can you have more than one associate within a area?
Okay, so I think, as I said, we were initially thinking the footprint would be an ICB footprint, but we're now being more flexible around that. So we anticipate that it could be a local authority area, it could be ICB, it could be, as I've said, a one or two neighbourhoods, as long as it has got that strategic focus. It's not a post that is about delivering a creative health programme. It is about how do we embed it in the system. So I think we're flexible around the footprint, the scale of this, but it's about the ability to influence the wider system is important. Can we have more than one in a geographical area? Again, we're wanting to try and spread these geographically, and we'll be taking a view on that as we move through the programme. We want to try and get them in all parts of England if we can. So that probably would mean that we wouldn't have more than one in a particular geographical area, but we'll take a view on it when we can see how the programme is panning out and where the interest is.
Great, thanks, Jane. There's questions about who can apply, which I think you answered slightly already, but we had a few different questions. So, for example, someone asked, is it possible to apply if this is a part-time role as a disabled person living with and beyond cancer with valuable experiences? Is it job sharing possible? You want to answer that one? I'll read another one in a minute.
Yeah, so questions about the actual roles are really a subsequent set of conversations to have with whoever the organisations are who are successful in getting this. So we will not be, we're not at this point saying this is the role. So it will be for so a health organisation is successful in making this first round application. We have a contract with them to deliver that programme. They then will recruit to that role, and they will make decisions about how they do that recruitment process. So I think all of the things around who's eligible for those roles, what skills are needed, will be a subsequent discussion. So this isn't for individuals to apply to at this point, but when the creative health lead roles, when systems are up and running and ready to advertise those, we would be helping them to promote those roles if they wanted us to do that, and sharing. And we would, and although I've said the recruitment process is not our business, we are there to support systems with that in whatever ways they need. So we have drafted a core job description with some core competencies. For example, we're happy to work with systems on how that job description develops and what the recruitment process might look like, and we can share our experience of that.
Great, thanks, Jane. And that kind of answers another question, which was when will we be sharing the creative lead roles and go live for recruitment? And that is what, as Jane said, that would be supporting those organisations to recruit and advertise for that. So we'll be supporting those organisations to do that. So there was a couple of other questions, I guess, it may be to do with partners as well as recruitment. Jane, so can these roles be located within independent research organisations and universities? There's quite a few questions about obviously it not sitting within health maybe and sitting more within universities and maybe local councils, obviously. So you already mentioned a bit, but do you want to expand on that?
Yeah, I mean, I think they're not research posts. I guess we're not anticipating that they would sit in an independent research organisation or university, but the local contexts do differ. So in some places we do know that there is a really, really close relationship between the university and the health and care system, and there may be some, it could be that there is a context in which that is appropriate, but we wouldn't be expecting them to be working for the university as such. This is not about a research place. This is about influencing the health and care system and embedding within that system. So we looked at on a case-by-case basis. I think it's not something we would be expecting. And I might need to go back and we might need to just have a bit of a think about that. And if someone's got someone's got something particularly in mind, it would be worth contacting us separately outside of this to explain that, so that we can respond to that context and understand a little bit more about what's behind it.
Okay, great. And then kind of similar vein, Paul asked, a lot of neighbourhood teams would be multi-agency. could the role sit within a VCSE organisation if they're part of the neighbourhood teams commissioned by health colleagues?
So I think that's the sort of example where we would say yes, we can see that is part of it's a system-wide team, and the VCSE organisation is part of that whole model of working. I think that's the sort of place where we would expect to we would be able to support roles in that situation.
Great, thank you, Jane. And so, for example, someone did ask, I'm a creative funded by a university, NHS and local council working on art projects for cancer screenings. Could you apply? And I guess in that remit, it would be working with those organisations they're already working with to get them to apply. Would that be right, Jane?
Yes, that's right. Yes, individuals, it isn't open to individuals to apply. It is for health and care organisations or partnerships to apply. So yeah, and it would not be funding existing work. If you're working on arts projects for cancer screenings, it would not be about, oh, here's some funding to support that piece of work. This is quite a clearly, we're trying to add to the work that is already going on.
Yeah, so I think that is maybe a question that Sandra had. It said, can you fund a role that already exists but is part-time, so in effect makes it a full-time role? Sorry, chuck that one in there.
Yeah, I think we'll have to have a think about that. I'll just need to put some parameters around that. I'll get back on that one. That'll be something. These are really helpful questions for us to be really thinking carefully around. Yeah, just a process that, because that is adding. I can see that is adding, but yeah, possibly I'll come back on that one.
Okay, other questions, kind of similar to one we had earlier from Matthew. If unsuccessful in round one, will you need to reapply, or will the application be rolled into the next round? I think you kind of mentioned it, but
yeah, we're happy to roll into the next round. We probably just want to do a check that nothing's changed, because there may be a slightly different context. As I say, if we felt that the application wasn't really strong enough for us to fund, even if we had all the money to do it, we would give feedback on that, rather than let people carry on thinking that we're considering it. So we would give feedback on those applications where we felt that they needed to be strengthened, but if there were others, we're happy to roll them forward. We don't want people to keep completing the application form unnecessarily.
Yeah, and that's similar. Matthew added in, just to clarify, does the funding application need to come from an ICB, or can any health organisation in that ICS region apply?
Yeah, any health organisation could apply. It doesn't have to be from the ICB, and it could come from a local authority.
Great. So a few more questions, Jane. I haven't got to the ones in chat, everyone, because I'm just reading the ones that are already in the Q&A. What NHS England programme is leading this?
So this is not an NHS England programme. This is a programme that is supported by Arts Council England and the Bearing Foundation, that National Centre for Creative Health are running. So we are leading on the programme. I think when I mentioned NHS England, I was talking about the neighbourhood health programme, neighbourhood health implementation programme, which we would be wanting to align with, really, where we've got creative health in neighbourhood teams who are in that implementation programme. It'd be really good to share our learning at that national level with that programme.
Okay, this kind of similar about that building on roles as well, Jane. So are you looking for new people in the process, or cementing existing creative health roles?
No, we are looking to add to the current creative health economy. That's what we're doing. Now, there may be places where there is a role that is currently, that may be coming to an end. We would want to, and it would seem foolish to not be able to support things that otherwise wouldn't, will not exist if we're not there. But we're not trying to. We want to be careful that we're not just subsidising work that might otherwise continue without this subsidy, if you see what I mean. We're wanting to add to it.
Yeah, so there's two similar questions around that theme as well, Jane. So I think as we're answering those questions, is the role aiming to coordinate existing creative health activity within the ICB area?
So in some places, if there is work already happening, it could be about identifying what that work is that's happening and really bringing that to the fore and finding sustainable ways of making that long-term ongoing programs. But it might be in another place that there hasn't even been very much thinking about creative health. This is a very early stages, and the role might be a lot more at that stage about mapping and finding out what's going on, if anything, and thinking about where the opportunities might be. So I think it depends on context. We know some places, there's a lot of work, there's a lot of activity happening. There isn't necessarily somebody sitting in the health system who's pulling all that together and showcasing it in the right places and ensuring that it's embedded in their plans and strategies. But there is a lot of work already happening. So in that sort of place, it would be around that type of role, but it could be in another place. It's very much, starting from a much lower point.
Yeah. Great, thanks, Jane. And around kind of a similar question, I guess, is about like the criteria. If you're looking at the spread of areas, does that mean if there's an existing associate role funded, you would be looking to fund them as a priority, and then other applications will have to wait for later rounds? So I guess that's like saying if there's already a role and would you look to them as priority to fund them, or would it? I guess that kind of goes into your question you just asked.
Yeah, we're going to be taking applications. We're going to be looking at them on a sort of case by case basis and looking at them at that time. We haven't got, at this point, we're not saying we're prioritizing this. The priorities, the criteria that you saw are those criteria really. So that's what we'd be looking at, rather than is this a role that's already there or not. That would obviously be important part of the context in the application to put in there. But that's our starting point. Isn't let's continue to fund roles that are already there.
Okay, great. Thanks, Jane. So there's some questions from Joseph around specific outcomes. So he was just asking, do you have specific outcomes that this post would need to deliver, or would it be a responsibility of each area to define the impact, and how will the scheme be evaluated?
Yeah, it's really good question. So yes, the particular outcomes for the roles would be to be determined locally. I mean, that's one of the things that we would be supporting systems and the post holder with that, because the context will be different. We are currently talking about our evaluation program for this. I mean, we've got basically. It's, as I sort of said at the outset, in terms of the programme purpose, it's about how does this get embedded? How do we get more creative health work happening? And how do we know when it is and that it's having benefit? And so there's something around, we're talking at the moment to potential evaluators and as part of our learning programme about what those impact measures might be and what tools people might need in order to be able to collect that. So a lot of this work is around a sort of ripple effect. And it's how do we sort of collect that information that demonstrates that actually, we're having all these conversations, and this is where some of them are leading to, and some of them we might not ever know about. But that, yeah, we've not got detailed performance measures for each role. For the programme, we are, as I say, still working with funders on what they want to see in terms of evaluation. But it's basically, we want to see more of this work happening in health and care systems in a more sustainable way. And how we measure that is really the tricky bit. But that's what we're working on.
Right. And Douglas asked quite a good question. Challenging, but good question.
Mm-hmm.
Very welcome on many levels, including the funding from within health systems. A risk could be that delivery budgets will rely largely or wholly on trusts and foundations with health social impact priorities, creating extra competition with existing creative health providers locally, regionally and nationally within a already thin to highly competitive field. Is this a risk that's being thought about? Any plans for mitigation? And I have another question on top of that, kind of links in, Jane. So if you want to reply to that one, and then I'll say the one.
Okay, yeah, I completely recognise that. And this is really about trying to move away from the funding for delivery being this sort of a stop-start, set of programs, people competing for funds. It's about how do we embed this more sustainably. So this will be the creative health lead roles will be about looking at current commissioning within current commissioning and provision within the health service, and thinking about where are the opportunities to find money from within the system. Now that is really challenging. I'm not suggesting that is going to be easy at all, but it does happen that if we can start to think about things in a slightly different way. So yeah, it is. I do recognise that. However, what we'd hope is that that in areas where there are existing programs of work, we're not looking for creative health leads to start, a whole new program. If there's a program of work, sometimes it's about bringing that program of work that is already being delivered with the support of trusts and foundations by an organisation, bringing that to the attention of the health and care system and to the colleagues, and helping them to understand and value it, so that ultimately they may well want to invest additionally into that. So yeah, we wouldn't want to see this should strengthen the role of existing organisations working in this field, because what we're trying to do is to encourage the health and care system to want more of that. So
Great,
yeah,
thanks, Jane.
Yeah.
So Leslie, I guess this kind of relates to this, suggested if there's an existing pilot program which already has very good data about making a difference to health and well-being in reducing inequalities, could this be considered? And I guess again that's about talking to an organisation and then working with them to apply. Is that correct?
Yes, absolutely. Yeah.
Great. So a couple more. Thank you, Lisa. She said this triangulates with the personal care roles to help mobilise the universal personalised care model to deliver the NHS LTP ambitions. Very exciting, which is very nice. Thank you. So Sandra said, this is at a time when the NHS is actually cutting back on creative health roles within hospitals. How does Arts Council and Bearing envision that these roles can be funded by health in the longer term? That's a tricky one, but I'll leave it to you.
That is a tricky one. Yeah. We know this is a really challenging time to be launching this program. So we have to see they'll have to demonstrate their value, and individual systems will see whether they are able to fund them. We are making representation from National Centre for Creative Health around the sort of cuts in hospital arts roles, because those have been around for a long time. And it could be that there's an opportunity for a role here that has a broader remit than that sort of hospital role, as part of this program, for example. But yeah, I don't know is the answer. We're expecting that that over the next 3 years, that we can demonstrate, or these roles can demonstrate their value to the system, and that there will be a commitment to continue to fund them. But we can't say that, but that's partly what this programme is about.
Great, thanks, Jane. So that's all the Q&As, but there's a couple more questions, just final ones in the chat.
Sure.
So Stephanie said, I'm based in Cambs in Cornwall, so am I right in understanding that the organisation applies and then the team, not an individual, commits to the programme? Would the funding cover an additional person to do the work that is missing because of the commitment to the creative health agenda, or would it fill people who are committed to the programme? Hope that makes sense.
Hang on, sorry. Let's have I'm just having a look at it in the chat. So the organisation applies, and the organisation applies and would commit to the programme, and then the way in which you use the way in which they use that funding, that would need to be part of the application process. What is this role that you're going to use the funding for? And it would need to be a creative health lead role. The funding would be used to support that role. So how that is managed within a team is for them to work out, but we would want to be seeing that there is a role that is called a creative health lead role, that is that is funded through this program. Does that make sense, Stephanie?
Stephanie, if it doesn't, please feel free to add in chat or raise your hand and we can put you, unmute you. And I guess that leads on to Joanne's comment, is that can you share the job description and core competencies? Because there's lots of people already doing this. So I guess it's to help those who may approach organisations to do that. And then if you want to answer that one, Jane.
Well, all the information, if you go onto our website, I think the link is in the chat. Yeah, Alex has put it in the chat and Alex has put in earlier. You can download all the information there, and that includes the draft job description. It is a draft. As I've said, it will, but can be adapted for local context, but it does give you that. And yes, definitely there are people doing this work already out there in the community, who would have these skills. That's what that's what we know, and we would be expecting when we get to that point, when the systems get to that point of recruiting, that some of those people will apply for these roles.
Great. And there is two kind of further questions. Can a community organisation with lived experience in creative prevention work, who work with the organisation, can they have the funds? I think we've already said something along those lines, but if you want to,
it will depend. It's really about the role having it would need to be a role that is working across the system, but it might sit within that organisation if that was appropriate for that context. So that is a possibility.
Great. And back to the Q&A, Paul and Lisa were just saying about kind of where it could sit, and said if it's embedded in neighbourhoods as part of the shift left into prevention rather than treatment, acute to community, that might be easier.
Absolutely.
And Lisa said framing the narrative that they are part of the personalisation work through creative health. She's put lots of lovely hashtags in there, which is great. Thanks, Lisa. And I guess that is pretty much it. We have one last question from Stephanie. She said thanks, but that makes sense. And is a lead manager needed to apply, or do you need an ops lead to support?
It needs senior sort of sign off, really, because it is working. It is trying to have that approach sort of across a system. It's got to be influencing more than just one bit of practice. So it will need somebody who's got some sort of senior sign off. I mean, we're not prescriptive about, it needs to be a director or it needs to be this, but it's, we would expect to see some senior sign off for it.
Thank you, Jane. I think we answered all those questions. That was a lot, so well done. Just in time,
so some of those,
pass it over to you.
Yeah, it's been really helpful to have those questions, because there are things, like I said to you, that we've thought about, but we're wanting to sort of really dig into the detail of what are people thinking, what might be needed. So we'll send out the slide deck and the recording, a link to the recording. We'll put those questions, the responses to those questions up on the webpage. It won't be immediately, but we will be doing that, so we can share those, and we will get back on some of the points that we haven't, if I haven't been able to answer those today. And if any of you do want to have a discussion about any of this, please do drop me an email, and we can arrange to have a catch up, either to answer a specific question or to discuss your ideas in a bit more detail. We're very keen to do that. We want this programme, we want people to have these roles in their systems. We want to help you to do that, all of you, in ways that will meet the needs of the programme. So thank you all very much for coming, and I do hope that we'll see applications from your systems in future. Thanks very much.